Howdy. Welcome to Healthcare Ain't Easy with Chris Matthew. I'm Chris Matthew. Today, healthcare can be exciting one day and confusing the next. It can be awe-inspiring or it can be terrifying. With AI now part of the equation, this often leads to more questions than answers. I've spent the last 2 decades navigating healthcare in a various amount of ways, but I'm going to be your guide here as we explore how AI and technology in general will impact healthcare and all of us. Through conversations with some of our most respected thought leaders like we have today, we're going to explore where we've been, where we're going, and how it affects the way we live every day. Ultimately, although healthcare certainly is difficult, it ain't easy. But we hope that by listening to this conversation and the ideas that we share will revitalize your optimism in the future of our industry and ultimately in our ability to care for humanity. As we continue to explore the challenges of the healthcare industry is facing, we know that there are many things we have to figure out, but we also know that communication and collaboration are among the first steps for a successful outcome for all of us. My why is to connect with people so that we boldly contribute to an improved world. If you happen to be generously sharing your time with us, we want to know what's your why. Drop us a note, follow us, because I am genuinely interested to hear and to learn and to find out where people find their purpose and their drive and their why. What am I excited about right now? Well, let me share. Today is my mama's 70th birthday. Happy birthday, Mama. I'm so forever grateful to you and your never-ending dedication to our family and the love you give so generously to all of us. You and Dad, you've shown us what to do to give generously. You've shown us how to try to recreate what you've given us as a family, and we and my brothers, your kids, we all try and aim for that high bar you've set. We love you a lot. We are excited to celebrate you today and enjoy the blessings of another year together. Love you. So today, I am very pleased to welcome an advisor, a guide, and a friend, Dr. Jeff Kerr, to the show.
It's great to be here, Chris.
Howdy, welcome. Dr. Kerr is the Chief Medical Officer at Baylor Scott & White Medical Center of McKinney. Dr. Kerr has a rich background starting in community health centers and over 20 years now has been growing and leading within the Baylor Scott & White health system. He's served the past 10 years as the Chief Medical Officer of Baylor Scott & White McKinney, a 200-bed hospital and one of the fastest growing population centers in the country. Dr. Kerr, thanks so much for being here with us.
It's a pleasure to be here, Chris. Thank you.
Well, let's start with what's good for you today. Today's my mom's birthday, so that's what's great for me. What's good for you?
That's a pretty good thing. So happy birthday, Mom, for you. That's great. For me, busy season. Looking forward to some fall foliage here soon with my best friend and bride, Michelle. We're going to get away next week, so that's pretty good.
You're definitely then leaving the state of Texas
That is
because you
correct.
said fall foliage, and that doesn't happen.
That's right. Around here, it just goes brown and falls off. So we're heading to Colorado for a few days.
Oh, that's going to be amazing.
Yeah.
That's great. So let's start with, before we get into your role as a Chief Medical Officer, give us the highlight reel about where you're from and what helped shape you to the person you are today.
Great. Well, in a nutshell, Chris, I've had a really atypical career path. Grew up in Texas, in the Houston area. Went to University of Texas undergrad. Had a brief stint away from school. Worked in the Washington, D.C. area, and then returned to Texas to enter med school and marry. And then very quickly came up through med school and residency training in family medicine. And after that time, joined the Baylor healthcare system, legacy Baylor system. After about 8 years in Waco, came to Dallas in 2003, and have been with Baylor Scott & White Health for the past 20 years. And the role that I play today is not one that I ever envisioned playing 20, 30 years ago. So my career development has been pretty, what we say, extemporaneous, and I've really been guided by the things that energized me. And so when I've made changes or moved into a different area, it's generally because something really drew my interests, or I could see where I could bring the most value. And so that's why I'm here today, as a matter of fact.
Amazing.
Yeah.
Help us understand, break down for us maybe, at what point in life did you determine medicine was going to be a calling or a profession for you that you were going to be
Sure.
passionate about? Because I believe you got to have passion to commit to that level of education and training and pursuit.
Yeah. So perhaps like many other people, as a younger person, I thought about being a doctor. I was, as a child, I have a congenital heart condition, and so I spent a lot of time back and forth at Texas Children's Hospital really every year until, gosh, I was in junior high or so. So I had a lot of exposure to the healthcare system, and I think I internalized that, and then figured out maybe I had the skill set to go that way. And so for a brief time, I thought I might pursue a career in PhD psychology, which I was actually pursuing graduate program in psychology when I decided to study for the MCAT and go to med school. But so I've always been intrigued with the sciences and the healing arts, people. I love to communicate, and so for me, it was a pretty obvious pathway. Yeah.
How did you find your path and your selection to family medicine of all the specialties?
Yeah. So similarly, so full disclosure, I'm a nerd. You know, I've told you this. You know this about me. I'm a learner. I love to learn, and so in med school, I loved every course and every clerkship that I took, and it's really torn because, you know, beyond surgery, loved surgery, beyond pediatrics, loved it, beyond OB, loved it, and I ultimately was decided that family medicine would give me the biggest breadth of clinical exposure, and I love the idea of having continuity relationships with patients and families, and so family medicine was obviously the best fit there. I thought about obstetrics as well, but I didn't want to limit myself to half the population, so there I went, family medicine. Yeah.
You know, we also love continuity of care and relationships. And that's kind of what actually brought us together when we first met.
That's right.
We're fortunate to have you as a guide and an advisor here for us with Sniffle, but I love that. I think family medicine is incredible. I think primary care is, they're rocket scientists. They have to solve for everything. It's not just one thing, one specialty, or half the population, potentially if you're an OB physician, but for all things, from birth to when we leave this world.
That's right.
That's amazing. What would you say? I know you've had a rich career. You've had lots of impact. How did you start in the community health center market? And for those that may be new to this, what is a community health center and why do they exist?
Sure. So that's maybe the colloquial phrase we use for what is known as a federally qualified health center. So back in the, I believe it was a Bush administration, that would be the W. Bush administration, there was federal legislation that created a category of health centers that if they met the appropriate criteria, they could be federally qualified. And what that meant was that if you had a health center that met certain criteria in terms of the patient population that you served, meaning it would be an underserved population, typically heavy Medicaid and Medicare percentages in a distressed population census tract, and you had certain other clinical elements like in-house lab, imaging, pharmacy capabilities, and a board that is comprised of the same patient population that you serve, you could qualify for this so-called FQHC. And the real genius of that program is that it enabled the providers and other caregivers in those practices to be eligible for special kind of Medicaid funding, Medicare and Medicaid funding, which began what I consider to be the beginning of a primary care revolution that's expressing itself in a number of different ways now, not necessarily limited to FQHCs. So I trained at a residency program in Waco, Texas, then known as McKinney County Medical Education and Research Foundation, which was the longest standing family medicine residency training program west of the Mississippi. And they're in Waco, Texas, of all places. And it was a fantastic learning environment. During my third year of residency, we had hit some real financial straits, and were it not for our ability to transform into an FQHC, it's a real question whether the residency program would have survived. And so that same federally qualified health center today is it's a juggernaut in Waco, offering behavioral health, dental, at like over 17 locations, including medical, and then like 75 million in revenue every year. And it's a beautiful example of how that model can really meet the needs of an underserved population. And there are great examples all over the country, which of course you know about.
Yeah.
So.
I have a real passion for what FQHCs and CHCs do, and rural health clinics. Health equity, health access is so important. And in our country, everyone should be able to do that and have great access to great care. And something that we're here to talk about, obviously, is healthcare and how do we use AI and technology to do some of those things. And in our experience, AI and tech, advanced tech, can really help people in rural parts of the country, for patients that don't have maybe reliable transportation, or have a job schedule that doesn't allow them to have a sick day. Being able to tap into these virtual solutions, it brings health equity to people in the palm of their hand. It gives them access, and I think that's so powerful.
Agreed. Yeah, the promise of how we achieve better access, more equitable distribution of healthcare resources, it's elusive, right? And I think enabling technologies like Sniffle, platforms similar to Sniffle, maybe not exactly like we're gonna see who moves the needle. And I think there's probably many right answers, but I'm very excited about the tech platform that Sniffle brings to bear on that problem.
Yeah. We are too. So let me ask, you've had a rich career helping community health centers, serving the underserved, teaching at a residency program, guiding medical students as they navigate this process, and now serving as chief medical officer, supporting lots of physicians and lots of specialties, caring for a major area of the DFW Metroplex that is growing at an accelerated rate. There's lots of places I'm sure you can point to moments of great achievement. I wonder if you could narrow down maybe one or two that are something that really stand out for your medical career.
Sure. Well, obviously, the most memorable chapter was our experience during the pandemic. And so I was and still am at Baylor Scott and White Medical Center, McKinney. And, that period of time, I'll never forget. It was just a time when our teams at the hospital and many other folks that we are connected with throughout the community did an amazing amount of problem solving and adaptation and alignment to meet the needs of that primary service area and to meet each other's needs. It was a tough time. My hospital took care of more COVID patients per hospital bed than any of the hospitals in our large integrated delivery network. So while we are only a 200-bed hospital, we were super busy, and many times we're taking care of more than 200 patients, not necessarily all COVID, but so the healthcare needs of the community never went away during COVID.
No, it did not.
And so super proud of the various solutions that our teams came up with during that time, but even more of the deep admiration and respect that I developed even greater, truly, as a result of going through that and watching my physician, nursing, pharmacy, uh, EMS services colleagues uh, just get up and come to work every day. So that was terrific. And if I would, in another vein, something that I just do take great gratitude, I have gratitude for, and am excited about, is the experience that I was able to have within Baylor Scott and White as they underwent their journey toward the implementation of enabling technologies and the process standardization of processes and content that today are really just table stakes for success in the acute care hospital services. So things like electronic health records and standardized order sets and ways that helped us design out risk and design in safety and efficiency for things like surgical safety timeouts. Before we take a person into surgery now, we have a timeout, and it's a standard checklist of items. Baylor Scott and White didn't develop it, but we embraced that sort of novel process design. And so I'd say those two are things that I've just been really proud of in my time there.
That's amazing. I would imagine that the pandemic, well, I don't have to imagine. I know I experienced it firsthand too. It tested all of us in ways, and the medical community rallied in a remarkable way to continue to care for us while the rest of us were doing the best that we could to hunker down. One of the things that I think really that came through that is that what was validated through the pandemic was we must find other solutions. We have to find other solutions. And one of those is we have to incorporate technology. We have to incorporate and be okay with virtual care. Telehealth was definitely validated for sure during the pandemic.
Absolutely. I would say that, and you and I have had this discussion, I mean, the pandemic basically enabled us to crash into the future and really fold time, probably moved 5 to 7 years into the future, which in healthcare, which typically moves at a glacial pace, is just unthinkable. And so out of sheer necessity, right, to create capacity and preserve access when clinics were closed, we pivoted, as did so many other healthcare systems around the country, to virtual platforms. And the true serendipity of it is we were in the process of developing a virtual platform just as the pandemic as it was becoming clear that the pandemic was going to be as serious as it was. So we were very fortunate. We were able to iterate very quickly so that within literally a couple months, we were doing over 70,000 virtual visits a day.
Wow.
Across all of our, like 300 plus ambulatory sites. So we were very fortunate. I wouldn't say we saw it coming, but the preparation paid off, that's for sure.
One of the things prior to the pandemic, this was definitely a conversation in the healthcare community, and absolutely since the pandemic, during the pandemic especially, we heard the word burnout, physician burnout, nurse burnout. Is burnout still something that you're seeing remnants of today in the medical community?
Absolutely. Yeah, no question. And I think it's not limited to the healthcare sector, but it's a very real problem. It's certainly less acute than during the pandemic, but what many people don't know is that during the years of the pandemic, 2021 and 2022, there were 5 to 10 times as many physicians retiring in a 12-month period in a number of disciplines across the country, notably anesthesia for one, just as an example, as many 5 to 10 times as many retirements in a single year than would ordinarily occur in a 12-month period. So we've seen just a dramatic reduction in the healthcare workforce, and nursing is the exact same. So the care burden hasn't gone away, and the workforce has shrunk. And so back to your point, we've got to find new ways of delivering care that not only meet the needs of the patients, but also help the providers and caregivers address the care burden without ruining their well-being.
Yeah.
Yeah.
One of the things,
deal.
it's a hard thing to try to pursue this, but it is a pursuit worthy of pursuit and effort. And that is, how do we help clinicians, physicians, nurse practitioners, PAs, nurses, how do we help them find pathways to reconnect to the joy of what brought them to this profession to start with?
Yeah.
And remove some of the friction and the administrivia that exist in the systems today. The bottom line, the way we simply talk about it internally with our team, is how do we help people do more with less? And tech, and in particular this new shiny thing in the world called AI, is a tool to come alongside people to help them do that. Because the reality, the workforce is, the numbers are diminishing, and we can't grow physicians or nurses or nurse practitioners or PAs fast enough to keep up with 5 to 10 times the retirement number. That's astonishing.
It is. It was dramatic. And so those disciplines today are having extraordinary difficulty recruiting, right?
Yeah.
And so in a growing community like ours, it's a real issue. But I would say, Chris, we've talked about this, but enabling tech it has promise, but it's not a panacea. And so while absolutely generative AI is, we don't know how big of a breakthrough it is yet. We all know that it's bigger than we can imagine, but there are other parts that have to be drawn along with the introduction of these new technologies that are absolutely necessary for, like, provider well-being, let's say, and that's connection, right?
Mm-hmm.
So that's why enabling technology, if it doesn't pull along with it the things that make a healthcare encounter really effective, enabling tech won't do anything.
Yeah.
And so that's an important thing to remember.
I think you're absolutely right. It's it has to come alongside a physician and a clinician and help them apply their skill set and their expertise and their empathy.
That's right.
To that person and help them do more with less. And I comment around this about when the first stethoscope came out, when the first lab test came out, when the first MRI or imaging machine came out. I'm sure people thought, "What in the world are you thinking? You can't throw a few drops of this solution in there and it's going to tell you what's going on in that patient." But now these are all tools that we absolutely rely on in our everyday life. But it takes time, and we're early. AI is very early.
That's right.
But it is a tool, and we believe that there is great promise in it. So we're talking about lots of the challenges in healthcare, but there's also lots to be optimistic about. And I'm curious, what is something that you're optimistic about in healthcare that's taking place today, or that you see on the horizon?
Sure. Well, what excites me is the fact that the delivery of healthcare is, in my opinion, it's a sacred transaction, right? It's a caregiver who has knowledge, skills, and experience that they're bringing to bear on a situation that can relieve suffering, promote health, and really help another person. So that never changes, right? And that's it's a bottomless well from which we can draw our own internal motivation and gratification as we try all these new things, right? So, consider, so when I'm talking with my teams, that's more than anything, we want them to be in touch with that fact that when you're at the bedside or in the office, whatever, and you're the one that's closest to the patient, you're the most important person on the healthcare team, regardless of where you happen to fall in the hierarchy. You might be rooming someone in or taking their vitals, or you might be the physician, nurse, or medical assistant, whatever, but you're closest to the patient. And so there's so much gratification you can derive from doing your job well, treating people like persons, and being a part of that overall enterprise to relieve suffering and promote health. And so I think that news never changes. And so I'm always excited about that. And I think helping people learn some of the new technologies or delivery methods, but hold on to that core tethering, that anchor will enable them to apply these new technologies in a way that safeguard that sacred transaction, right? So that's what I'm
It's
saying.
all about relationships.
We would agree.
We definitely agree on that. So we've mentioned I'm fortunate that we were able to meet through Sniffle, and we're happy to have your guidance and be on our team. But our take on virtual care, obviously. But I'm curious to get your thoughts on the current business models. And there's been some recent transactions here recently in some major retailers that are trying to bring virtual care to the masses. And obviously, in my biased opinion, I believe that the business model is flawed because they're putting patients into retail situations where physicians and clinicians are doing a primary care visit and getting $20. And my question is that concept of that type of a business model, is that good for physicians? Is that good for the clinical workforce? How does that support docs?
Yeah, so I think that, again, we live in a country where all kinds of novel delivery methods are going to be experimented with. And the good news is we have consumer-oriented patients and families that they will show us what works. So sometimes people do want a very straightforward transaction with the healthcare provider. They don't really want to get into a long-term continuity. They just want a transaction, and they're perfectly content to pay $20, get on, get out. And I think we need to provide that, right? But I also think that as far as the healthcare workforce, those folks, I don't think that would be a long-term generative activity. I sure couldn't do that job day in and day out because, again, for me, I derive gratification from connecting with people and not just in a consumer transaction. So no, I believe that we need to be very realistic about the scope of the services that patients and families want. And we need to be creative with the technologies that can make that simpler, but we need to design in the continuity that gratifies everyone. I think.
And long term, a business model like that, again, in my very biased opinion, I don't know that supports patients because something you just mentioned, you draw gratification from connecting with your patients. I've been fortunate to meet and work with lots of incredible primary care docs across the country. They drive incredible gratification from the connectivity with their patients.
Mm-hmm.
If these business models continue to flourish and it becomes more of a transactional thing, that burnout that we were just referencing, I see and I could predict that would probably continue at least on that path, if not accelerate more. And that does an even greater disservice to patients in the future as we try to increase access to health and health equity for all of our friends and families and communities across the country.
Yeah, it's pernicious, no doubt.
Do you, when you're sitting there and you've got your chief medical officer hat on and you're running the business side of how to make sure that all the specialties work together and that the patients are getting what they need and the nurses are getting what they need, and that's a big thinking cap that you've got to wear. When you look to your physicians and you look to the community that surrounds you all, what can we do as a community or a society, maybe in a larger scale, what can we do better to support our clinical workforce? How can we support physicians and show up for you to make things better for you?
That's a good question. I think, healthcare providers, I'll limit myself to, physicians and advanced practice professionals because I'm not a nurse and their role is different and I have tremendous respect for it. But, I can tell you, if you haven't worked in a job where you are exposed to uncertainty and to suffering and to limitation, and you can't really control for what's going to walk into your office or into your exam room or the hospital that day. If you've never worked in an environment like that, it's difficult to relate to what a healthcare provider experiences. we would say the same of our first responders, right? It's very difficult for folks who don't know what they experience to relate to them. So I'd say the same thing about all public servants, right? So when I talk with my EMS providers, law enforcement, my fellow healthcare providers, what really puts gas in people's tanks is just thank you. And when I'm out there and I get a chance to, buy somebody's coffee behind me who I can see their EMS or whatever, just the thank you for being willing to expose yourself to the uncertainty, to serve for the well-being of your fellow citizen, that's what makes it puts gas in those folks' tanks, I can tell you.
That's wonderful.
Yeah.
Well, that is a perfect transition to our final question. So Chris Schembra is a Wall Street Journal best-selling author, and he wrote a book called Gratitude and Pasta. He makes a delicious pasta sauce. I'll get you a bottle.
Okay.
And he hosts these great experiential dinners, and the dinner is surrounded by this one question. And everyone who sits at the table answers this one question. So I'm here to pose that question to you. If you could give credit or thanks to one person in your life that you don't give enough credit or thanks to, who would that be?
Oh, that's very easy. That would be my wife. My wife of 32 years, Michelle, who I am a fast-moving, high-energy person who has not passed the thanks around enough. And Michelle and I have raised 4 awesome adult men, and we have an empty nest now. And I would absolutely, I don't think I could tell her thank you enough for our adventure, which continues. So, Michelle, thank you. And that's a great question.
Well, the trip is going to continue with fall foliage in Colorado coming up. So there's going to be lots of opportunity to share that gratitude. And I want to say thank you to you. And I have incredible gratitude for your guidance and your fellowship and your friendship. And it's a real pleasure.
Well, it's mutual, Chris.
Thanks so much. We are grateful for the time with Dr. Jeff Kerr. And remember, healthcare ain't easy, but it is something that we can do together. Talk to you soon.